Good morning. I'm Gail Gettens. I'm a health promotion advisor and a child development specialist with New Hampshire's Healthy Homes and Lead Poisoning Prevention Program. Our program is part of New Hampshire state government in the Division of Public Health Services. And our program, the Healthy Homes and Lead Poisoning Prevention Program, and my position are largely funded by the Center for Disease Control through an annual grant. I'm also presenting today with Joe Keene. Joe is a Northeast specialist with Meridian Bioscience. Joe, do you want to introduce yourself?
Yes, I'm the local lead care rep for New Hampshire. Work with a lot of practices, and Gail educating the folks in New Hampshire on the importance of lead testing.
Thank you. So the way we've worked this out this morning, that we will hopefully pull off seamlessly in this virtual platform, is I'm going to start with a PowerPoint and to give you some of the information and data that we have on how using point of care testing right in the pediatric office has really helped to increase our testing rates in New Hampshire to get more children tested. For those of you who aren't have an appreciation of point of care testing, it means that a child can be tested right in the office when they go in for their well child check at age 1 and age 2. And point of care testing is just that. And we're going to be talking about testing that's done with a lead care 2 analyzer, which means that a child can be tested with just a few drops of blood from their finger. So they don't have to make another trip to a lab and have a venous draw, meaning a needle put in a 1 or 2-year-old's arm. It can be done with a finger stick right in the office and with a lead care 2 analyzer that parents and the physician can have the results within 3 minutes. So they know the child's test results, the blood lead levels, before they even leave the office. So I'm going to share my screen. And I'm going to tell you about our success story in New Hampshire using a number of a 5-point strategy, but a big part of that was point of care testing. And then when I'm done with that presentation, Joe will come back in and he will actually demonstrate how this testing is done so that you can see how very easy it can be done in an office. So that's a lead care 2 analyzer that's right on the screen if you haven't seen one. So we introduced ourselves. So much of this presentation in terms of our success story was actually published, if you want to dig into it any further, in the February 2019, so a little over a year ago, in the Journal of Public Health Management in Practice. It was written in, along with my supervisor, Beverly Druin, was a whole article on this topic. It was also a research poster. If you work with folks that are kind of data light or an age group that doesn't read as much, we can send this to you as a poster. It's kind of the whole story in an infographic presentation that can be helpful in meetings as well. So this story is largely the work and the plan we implemented in 2016. And the backdrop to that was between 2010 and 2015, our testing rates in New Hampshire were very, very low, if not flat. And we averaged well over 650 children annually during that block of time. That wasn't cumulative. That means we had 650 children or more in 2010, and another 650 or more in 2011, and 650 more in 2012. You get the picture. 5 micrograms per deciliter that's on your screen. That means it is a test result. A child had a blood lead level test and the results were 5 or greater, which is the CDC's reference level and the American Academy of Pediatrics reference level that a child's been exposed to lead, they've been poisoned, and they're in need of case management. And throughout this time, though we were identifying, well over 650 children every year, fewer than 25% of our kids had even had a test. So we were finding this huge number where we were testing this very small number. So these show the trends between 2010 and 2015, and it wasn't any better before. This is just the block of time that we pulled out, the 5-year history as we started this work. And you can see that the tests were not only dropping, we're flatlining for our 1-year-olds, the blue line, and for our green, the 2-year-olds, which were so low, fewer than 30% of our 2-year-olds who should have been tested under our screening guidelines at that time were even tested, and they were even dropping. So we had our work cut out for us. So I actually came on board in October of 2015, and I'm in charge of kind of doing a needs assessment, figuring out what was going on, why were our testing rates so low and declining when we were in such a high-risk state, and knew that we had so many more children that were being exposed that weren't being identified. So we came up with identified three major obstacles in working with public health agencies and our pediatricians and New Hampshire chapter of AAP. And the biggest barrier, the largest barrier that became evident was that in New Hampshire, there was very little, almost non-existent point of care testing. Whereas children weren't able to be tested in a pediatrician's office with just a finger stick. That New Hampshire was relying heavily on a venous draw, meaning a parent and child had to leave the exam room and at best be in the same building, if not go to another draw site or a hospital lab, to then have a venous draw on a 1 or 2-year-old to then get the test results several days later. We also discovered that our medical community didn't necessarily understand our screening guidelines in New Hampshire, which have since changed, but were confusing at best. And we also learned that our New Hampshire chapter of AAP, we didn't have any statewide conference within New Hampshire for our pediatricians, sponsored by that organization. So we didn't have a platform or an easier platform for us to educate a large number of our pediatricians at one time. But the overwhelming barrier that became startling evident to us is that we didn't have point of care testing, that we were relying on a venous draw. So we put together and implemented a 5-point strategy to increase our testing rates. And the good news is that it worked, and I'm going to tell you that story. So our 5-point strategy included developing an education program so that we could go out and present face-to-face to our pediatric healthcare providers throughout our rural state. I put a lot of mileage on getting out all over our state, largely in a lunch and learn format. And if you look closely in this picture, I'm in the back educating. This is a group, the pediatricians and their clinical team at Core Physicians, Pediatrics and Family Medicine in Epping, New Hampshire. And we provided lunch, and we provided CEUs and nurse CEUs. And we did this all over the state. We also educated our pediatricians on point of care testing. Many were not aware that this device was available, fully endorsed and developed with funding from the Center for Disease Control, been out there since 2004, highly reliable, highly accurate, have the results in 3 minutes before the families leave the exam room. So just education that it was out there and available. We also developed medical quick guides. These are laminated quick guides for physicians, pediatricians that they can keep either at the workstation or right in the exam room on medical management of children who've been exposed to lead, evaluation, treatment, as well as we put a quick guide in there right on using the lead care tube. So that as they began to be deployed in New Hampshire, they would have that reference guide as well. We also developed some parent reminders. On the left is a poster at 1 and 2, testing for lead is what to do, that our program developed. And I'm proud to say it is posted in nearly all, if a vast majority of our pediatricians' offices throughout the state. And we also purchased board books, Sleep Baby, Safe and Snug, which some of you may know as the Safe Sleep book. And you can see on the back of that book, we created our poster as a sticker. And any of the programs, pediatrician's office that we went through our lunch and learns, we would give them these books free of charge and continue to replenish their supply so that they could hand those out to parents. So it provided both a safe sleep message, but also a reminder, a tangible reminder that would hopefully hang around the house for a little while to get your child tested at age 1 and age 2. And we also work to bring more of the point of care testing equipment into the state. We used our preventative health block grant funds at the end of a block grant year. There was funding still available, and we used them to purchase 10 of the devices along with test kits, and we were deploying them in our highest risk areas, especially starting with our federally qualified healthcare centers. Any of them that didn't have the point of care testing equipment, we provided them through grant. But also significantly, when we put the devices in, we provided training. It was part of the grant. If they accepted the device, then we went in and trained the providers on this issue. And we also trained those on how to use the device with Joe's assistance. But also I did training on the requirements for reporting the blood level test results. So the results by the numbers. In 2016, I did 25 medical education training sessions throughout the state, targeting our high risk areas in this first year of outreach. 332 pediatric healthcare providers and their clinical teams participated in the training that took place right in their office in 2016. We got 16 new lead care 2s into New Hampshire. Prior to that, you could kind of count on one hand how many we had in New Hampshire. Most of them, the very few we had, like less than a dozen, were in our WIC clinics. Very few, like literally less than one hand, were in medical practices. 2,040 parent reminders went out. So the Safe Sleep books went out with our reminder sticker on it. Very popular with our pediatricians who were continuing to ask for additional supplies to give to parents and new families joining their practice. And the change, we saw change, and it was significant. We began to see our blood lead level testing rates increase for 1 and 2 year olds that had been flat and even declining for years. A piece that I wanted to show you though is just some individual practices. So what you're seeing on the screen is 4 pediatric sites throughout New Hampshire, so pediatric offices, and their testing rates in blue. In the 6 months before, I went in and did a lunch and learn, and then the pediatrician office either received a lead care 2 through our grant program at the time, or they purchased their own at the time. And then 6 months after those 2 interventions, meaning our training and starting use of point of care testing, what their testing rates were in the 6 months prior. And you can see it is absolutely startling. The first site, I actually tell you, is Dover Pediatrics in Dover, New Hampshire. In their 2 sites, Dover and Lee, in the 6 months prior, they did 24 tests. In the 6 months prior, they did 490 tests. The others are throughout New Hampshire, from Laconia to Monadnock Community Hospital, Pediatrics. All of them, the increase is startling. From 7 to 190 tests, or 98 to 257. When you can see that once the providers were educated and understood the issue, and once point of care testing went in, that parents didn't have to make a second trip to a lab or to have a venous draw, you could see the difference in the testing rates. And here you can see that same graph that I showed you earlier with our testing rates that were flat or declining between when we started this intervention. You could see by the end of 2016 how our rates had started to go up finally. And these results are sustained. We've continued with this same 5-point strategy, and you can see that they've continued to increase. We're not at 80 or 90% yet where we'd like to be, but we certainly are going up. And the the 2-year-old testing, which is the orange bar on this graph, is what we're so pleased with seeing the change. You know, lead poisoning in the United States peaks in children about 18 months. So the 2-year-old test is so important. And often it is either overlooked or if a parent had gone and pinned down their 1-year-old for a venous draw, they're really not interested in trying to pin down their very active, much larger 2-year-old for a venous draw. In addition to that, parents who had a low or non-detected test at 1 weren't understanding that by 2, their behaviors had changed. They're crawling, pulling to standing, walking, putting everything in their mouth, playing on the floor, and that their risk factors have really gone up for lead exposure. So the 2-year-old test is really, really important. And it often, as you can see, wasn't getting done. But with point of care testing and education, we began to see that rate go up and continue to really go up. And that was a huge part of our success story with going to point of care testing. So I'm going to stop my data presentation here, if you will, and stop sharing my screen, hopefully here. And I'm going to switch over to Joe, who can then give you a demonstration. I'm going to shut my camera off and he will go and show you, I think his wife, Caroline, is going to be the person that's tested. So I'm going to shut my camera off and he'll be able to show you how simple it is and how easy it is to do the test and get the results so quickly. The only piece that I'm just going to stress again, as I'm sure Joe will, is that it's critically important before you do this test with young children to wash their hands. Alcohol swabs do not remove lead from your fingers. So that if you do an alcohol swab, it will be highly sanitized and germ-free, but there still can be environmental lead on a child's finger that can contaminate the sample. So it's really important to use soap and water and wash off any lead and then use an alcohol swab before you do the finger stick. Okay, Joe, I'm going to shut my camera off and turn it over
to you. Ready to go. Thanks, Gail. So just want to make sure everyone can see this. So I'm going to get my face out a little bit so you can see more of the actual analyzer. But as Gail said, I'm the rep for lead care. So if any customers are out there watching or anyone that needs information, we actually have one of the virtual booths where you can get some information on lead care, my contact information. We can always set up a call to discuss. First and foremost, as Gail did say, hand washing is the critical first step to make sure we're getting really accurate results. So if you have sinks in all the exam rooms, but you can also use some of these kind of portable washing systems where I'm just going to take the finger that we're going to use, either middle or ring, and just kind of soap and water over and over. It doesn't hurt with a baby to get the surrounding fingers as well. And we're not going to use paper towels to air dry. I'm sorry, we're not going to use paper towels to dry. We're going to use the air drying method. Some of the recycled papers can have trace amounts of lead. So we just want to eliminate any possible source of contamination. So we'll go ahead, we'll try and air dry. The reason we are doing the hand washing, like Gail said, the alcohol wipe alone isn't going to remove lead from the skin. So if we did get like a false positive, it's usually tied back to contamination due to a lack of hand washing. But we are still going to do an alcohol wipe after the fact. So once we've done the hand washing for the actual finger stick, we'll do a finger alcohol wipe. Get a 2 millimeter, 1.8 lancet. And what we're going to do is have our treatment reagent here. Now that we're done the hand washing, all of our test kits for lead care come with every piece of material that you're going to need outside of gauze, alcohol wipes, and lancets. So we're just going to loosen our treatment reagent container. And what happens is the blood gets mixed in with this treatment reagent, lyses the red blood cells, and allows us to get the actual lead reading. With the actual lancet, we're just going to go right to the tip of the finger, right off the side of the pad, firm, And one of the key steps with lead care is making sure we wipe the first drop of blood. All right. So we're just going to kind of hold the capillary tube right here. Allowing the sample just to collect up. So there's a black stopper. It's 50 microliters of blood that we need. And it's very specific that we get the full 50 microliters so we get the right reaction with the treatment reagent. We don't want any air bubbles or anything like that.
This is Gail again, and as Joe's working on this, I just wanted to mention, you know, there are some other capillary collection options that I just want to point out what some of the issues are with them. In a pediatrician's office, they can collect a capillary sample into a tube that they'll send out, but that requires 200 micrograms versus Joe just collected 50. So 200 micrograms is a whole lot of blood to squeeze out of a 1-year-old's finger. And in addition to that, those that are doing those tests often are not trained, as you are with the lead care too, on the importance of washing hands. So those samples are often contaminated. And then that ends up with a false positive, and then all kinds of other issues result. So this is a much smaller sample collected properly and results in 3 minutes.
Correct, yeah. And with these capillary tubes, they're really easy. You can't overfill them. They're heparinized, so you've got plenty of time. You've got 10 minutes. So if you have to bandage up a baby, do a hemoglobin test, any other things like that, we're just going to plunge the sample right into the treatment reagent, recap it, and you're going to notice that it turns the blood a dark brown color. There's nothing wrong with it. That's that lysing of the red blood cells. And we're going to invert this 8 to 10 times to start mixing in the blood with that treatment reagent. The intended use of the lead care is to be able to get the result done while the patient's still in the office, but you do have some timing flexibility once you get it mixed in here. Once that sample is good to go, we're going to grab one of our sensor strips. And your sensor strips will look like this, and they just go right into the nose piece of the analyzer. The last step, the test kits come with these basically pipettes. We call them little droppers. And it's just one firm squeeze and release. You're going to get some sample in there. And then right onto the sensor strip, you're going to dispense all of that until you hear a beep. And as Gail mentioned before, it's a 3-minute runtime. So as soon as that sample is placed on the sensor strip, it immediately starts a 3-minute countdown. It's going to beep at you, and that result is going to appear as a quantitative result. So it's not going to be just positive or negative. It'll actually give you down to the decimal point in the actual reportable range of the analyzer.
This is, again, while we're waiting for that, I just wanted to mention that in a lot of our medical practices, our pediatric practices, they'll do this test as part of a rooming process, so that by the time the provider, the pediatrician, actually goes into the room, they have the results to share with the parent, to answer any questions or ask questions, and to do any education that might be required depending upon the results. So, for example, you know, if you take your child in and they weigh your child and they measure your child and, you know, they take their blood pressure or what all the other kind of things that they're gathering, they will do the test at that time. They will often, if it's a 1-year-old, do the hemoglobin test as well. And then the provider, the pediatrician, you know, usually on the door is a little slip that has the results of the lead test and the hemoglobin that they take right in and can share and discuss with the parent. So that's the beauty of having it done in the office and having the results before the child leaves. It's also so much easier. Go ahead.
I was just going to say, there's more information on the Meridian booth. I'd actually put a PDF copy of a case study that was done with Core Pediatrics in New Hampshire which shows the process that Gail's talking about.
And it certainly saves a pediatrician's office, you know, in working to make sure they're in compliant with the laws. You know, they don't have to be checking the medical record, you know, the electronic records to see if, has the parent gone to the lab, have the results come in, if the results have come in, getting them to the parent, if the parent hasn't gone to the lab and the child hasn't been tested, doing those follow-up calls and that follow-up work, you know, with the point.
Nope, might have lost Gail's audio. Gail, did we lose you?
We lost her picture as well. So I think we might have lost her. We'll see if she's
Picture, yeah, we'll let Gail get back on. Oh, there she is.
Joe, you're back on. I can see you. You're moving.
Yep, I think you're back. And that's good timing. So as Gail kind of popped off, after the 3 minutes is done running, like I said, there's a beeping sound that'll pop off and the previous result will stay on the screen. And that beeping sound will keep beeping to remind you to pull your sensor strip out and log your result. But to give you an idea, that is how the result will be displayed. I think for this one, it's going to come up as low because my wife has a lead level that's less than 3.3. The analyzer will read anything from 3.3 to 65 micrograms per deciliter. We always hope that the most common result is going to show up as low lead level on the analyzer, which means that when it gets reported to the state of New Hampshire, it's critical that it's reported as less than 3.3 so they get a numeric value. But again, if anyone has any questions on lead care, wants to look at a package insert or anything like that, you can always reach out to me. And as Gail said, anytime a new analyzer goes in, we make sure to do some education and training. Other than that, should I pass it back to you, Gail? Oh, looks like your audio's out.
Thank you, Joe. I'll just wrap up with a couple of other thoughts as we work to increase our continue to increase our testing rates. The lead care 2 works on batteries. Not only for New Hampshire where we lose our electricity more often than not, but it can be used in the field. And I certainly know of a few communities that have either partnered with a health center or even partnered with a other agency that they've done the testing right out, offered it, if you will, at a back to school night and other places where families may be gathering where their children haven't been tested at different health fairs. So there's a beauty in it as well that you can bring it along. Our Nashua Health Department, Manchester Health Department, our program, New Hampshire Division of Public Health Services have these devices so that we can take them, so to speak, on the road and in the field if we are doing testing at events where we can educate families on lead exposure, but can do the testing right there as well. So this device has been a game changer in New Hampshire in helping us to improve our testing rates, continue to improve our testing rates to make sure more of our children are being identified who are being exposed to lead so we can support the children and their families and to end the exposure, to get them away from the hazards. So I'm going to end there, and Patty Crocker from Nashua's Health Department is our moderator to help us with any questions, if there are any, from any of those of you that are watching this broadcast.
Thank you both, Gail and Joe. What a wonderful presentation. Thanks for showing us how the lead analyzer works. I've always wondered, so I haven't seen the demonstration. It was nice to see that. If anyone does have any questions, you can type them into the Q&A. We can give people a few minutes now to do that. As of now, we have no questions. So if people submit questions after we sign off, we will ask Joe and Gail to answer them. and we will get the information posted. So with that, thanks again, both of you, and I hope you have a wonderful day.
Thank you, Patty. Thank you.
Thanks so much. Take care.
You as well.